Hi, Miss Massey. My name's Brittany, and I'm going to be your student nurse today. And I'm going to be performing your physical assessment from head to toe. First thing I'm going to do is wash my hands. All right, can I see your bracelet? What's your name and birthday?
Aubrey Massey, 11194.
All right, and the first thing I'm going to be looking at today is your head, face, and scalp, and I'm going to inspect your scalp first. So what I'm looking for are any lesions, abnormalities, or any infestations, and I didn't find any, so that's good. And the next thing I'm going to do is palpate your sinuses. So tell me if there's any sensitivity or pain. Your frontal, your maxillary. All right, and the next thing I'm going to do is palpate and inspect your auricles, which are your ears. Let me know if there's any sensitivity or pain. Tracheases, is there any sensitivity? I'm also checking to make sure there's no lesions, which there isn't. I'm going to look inside your ears to see if I see any drainage or cerumen blockage. And I didn't see any, which is good. And the next thing I'm going to do is inspect your eyes. And your eyebrows and your eyes are both symmetrical to your face. And now I'm going to check to see it, look at your conjunctiva and your sclera. So I'm going to pull down on your lower eyelids and ask you to look up for me, okay? All right, your conjunctiva is pink and moist, which is good. And then I'm going to pull up on your eyebrow lid and ask you to look down. And your sclera is white and moist, which is good. Now I'm going to see if your pupils are reactive to light. So I'm going to shine a light in your eyes and ask you to look straight at me. All right, good. Now can you follow my pin light for me? All right. Now look at my pin light and back at the wall behind me and back to my pin light. Good. Your eyes have met perla, which means your pupils are equal, round, and react to light, and they both accommodate. Okay. Now I'm going to inspect your nose, so I'm going to ask you to look up for me. All right. Okay, and what I'm looking for is to make sure your mucous membranes were moist and your septum was midline, which it is. And I'm going to ask you to flare your nostrils really quick for me. All right, and they both flare symmetrically, which is good. Okay, and now I'm going to inspect your mouth, so I'm going to ask you to actually, I'm going to check the patency first. So I'm going to put a finger on your nostril and ask you to inhale for me. Okay, and the other side. All right, and your clear blockage. Now I'm going to look inside your mouth and just ask you to put your tongue up. Okay, side to side. All right, now say ah. Ah. All right. Your lips are pink and moist. Your gums are pink and moist. Your tongue is pink and moist. And your lips don't have any lesions, your palate doesn't have any lesions, your gum and tongue doesn't have any lesions, your uvula and, is intact, and your tonsils are not intact. Okay, and now I'm going to inspect your neck and make sure I don't feel any, your thyroid is enlarged, and I'm going to make sure your trachea is midline. Your trachea is midline, and there was no enlargements of your thyroid. And now I'm going to auscultate your carotid artery, and what I'm trying to hear for is any brewery, and that just means if there's a brewery that it's an indication of blockage or narrowing of the vessel. All right, and you were clear of that. Now I'm going to palpate and inspect your anterior thorax. And what I'm looking for is to make sure there's no edema, I'm making sure there's no lesions, and that your skin is consistent with the rest of your body. I'm also checking your temperature, making sure I don't feel any moisture, which I don't, which is good. And I noticed that you weren't breathing with your accessory muscles, which is good. Okay, and now I'm going to auscultate your 8 lung fields. And I didn't hear any crackles or rhonchi, which is good. Okay, and now I'm going to check your, I'm going to put my hands on your chest, and if you could breathe in for me, and breathe out. Your lungs rise and fall symmetrically. All right. Now I'm going to teach you about our breast exam. Do you give yourself monthly breast exams? Okay. Well, you should always give yourself monthly breast exams because it's early detection of breast cancer, and you especially need to do this if you have family history of breast cancer. And it's good to do it maybe 2 or 3 days after your menstrual cycle around the same time each month. Okay, so I'm going to teach you how to do that. You're going to raise your hand, and you're going to take your other hand and put it underneath your axillary, and you're going to go in a spiral motion towards your nipple. And once you get to your nipple, you're going to squeeze and make sure you don't see any discharge. If you feel any tender lumps or see any discharge, you need to contact your physician immediately. Okay? And the next thing I'm going to do is inspect and palpate your posterior. I'm going to inspect and palpate your heart, which is also called your cardiac. And I'm just looking for any, I'm trying to feel if there's any visual pulsations or thrills. And I didn't feel anything. And now I'm going to auscultate your heart and its valves. On the right of your sternum is, in the second intercostal space, is your aorta. And on the left of your sternum in the second intercostal space is your pulmonic. And below that in your third intercostal space is your Erb's point. And below that in your fourth intercostal space is your tricuspid. And below that in your fifth intercostal space is your mitral. And while I'm down here, I'm going to listen to your apical pulse. And I didn't hear any dysrhythmias or murmurs. Your heart is also in between your second and fifth intercostal space. Okay, now I'm going to palpate and inspect your posterior thorax. And what I'm checking for is to make sure your skin is consistent with the rest of your body and that there's no lesions or edema. And I'm going to ask you to breathe in for me. All right, and your lungs fall and rise symmetrically. Now I'm going to be looking at the curvature of your spine and making sure that I don't see any scoliosis or kyphosis, and I don't see any. And I'm also going to be listening for the, I'm going to auscultate your 10 lung fields. All right, I'm going to check the one lobe on your lateral side. Okay, and I didn't hear any crackles or rhonchi, which is good. Now I'm going to inspect and palpate your upper extremities. Okay, and what I'm checking is to make sure there's no edema or any lesions, and I'm checking the temperature and to see if I feel any moisture, which I don't, and it's consistent with the rest of your body. All right, and now I'm going to check your turgor, and there's no tinting, which is good. And now I'm going to check your capillary refill, and they're less than 3 seconds, which is also good. And I don't see any clubbing or chipping on your nails, which is also good. And I'm going to inspect your strength. So if you could push up on me. There we go. Good. Now push down. Good. All right. And I'm also going to check your pulses. There we go. And your brachial and your radial. And now I'm going to inspect and palpate your abdomen. So if you could lay down for me. All right, can you take a deep breath in? Okay, and I'm just making sure that I don't see any enlargements or masses. which is good. I don't see any. Now I'm going to auscultate the 4 quadrants and make sure I'm going to be listening for any hyperactive, hypoactive, normal, or absent vowel sounds. I'm going to start in your lower right quadrant and go up to your upper right quadrant, upper left quadrant, and lower left quadrant. Okay, and I didn't hear any hyperactive or hypoactive vowel sounds, which is good. They were all normal. And if I didn't hear any sounds at all, I would listen in each quadrant for at least 5 minutes until I did hear something. Okay, and now I'm going to palpate your 4 quadrants. So your right lower quadrant, your right upper quadrant, your left upper quadrant, and your left lower quadrant. And I didn't feel any masses or abnormalities, which is good. Okay, and now I'm going to check the lower extremities. Okay, and what I'm checking is your skin to make sure there's no lesions or edema, and which is good. You don't have any of that. And I'm also checking your temperature, making sure your skin is consistent with the rest of your body, and I'm feeling for any moisture, which I don't feel any, which is good. And now I'm going to be checking the capillary refill. Okay, and your capillary refill is less than 3 seconds, and I'm going to be taking your pulse, your tibial, posterior tibial pulse, and then your dorsalis pedis pulse. Okay, and they both sounded bilaterally symmetrical. Okay, I'm going to test your strength on your legs. Can you push up for me? All right, good. Now push down for me. Good. And now I'm going to check your range of motion. So flexion, extension, abduction, adduction. All right, and I am done with your physical assessment. You can sit up now and put on your shoes. Thank you.
Thank you, nurse.